factor in everyone's lives. So we are kind of in a society where lots of our schedules are tight, and we have a lot of responsibilities and a lot of things that we're trying to do. And so stress is going to play a huge role as far as that relates to health too. So I'll talk a little bit about that. I'm going to kind of have to go back and forth with my computer though, so bear with me. Okay, so the name of this is From Stress to Success. And would you guys agree, I just have a question, do you think that your health is related to stress, or that stress can affect your health at all? Yes, absolutely, right? And there's different aspects. Stress can come from a physical state if you have, auto accidents, slips or falls. Stress can also come from a chemical state where the things you're putting into your body can affect the way your stress levels. And then also there's the emotional side. So it's the physical, chemical, emotional aspects of stress. And I have a bunch of them listed out here. So like I said, there's the obvious ones like traumas, where you have slips and falls, sports injuries, auto accidents. And then there's the things that we're putting into our bodies. There's a lot of processed foods, medications that we're taking, and all of that's going to play a role with your health and stress level too. And then also there's the emotional stress too. So our relationships with others, and whether it's at work or family, that's all going to play a role into your health as well. So sometimes you can feel like you're being drowned in stress. And what happens is when your body is feeling the effects of stress, it's going to weaken your immune system. It's going to cause muscle tension. It can raise your blood pressure. It can raise blood glucose levels or blood sugar levels. And it raises cortisol levels too, which is your quote-unquote stress hormone. And then what that can do is that can lead to the physical pain that you might feel from being stressed. A lot of times I'll have patients come in the office and they have headaches or tight shoulders because they've been working on a desk all day, or they've been having a very physical job where they see a lot of muscle tightness and things like that. So these are some of the effects that stress can have on you. And so sometimes when you have a really stressed day and you feel like you're just about to explode, we all have different coping mechanisms or ways that we want to deal with stress, and they're not necessarily always the most healthy. So some of us, if we're already feeling the physical symptoms, might start taking medications like Tylenol or Advil, or we might even be already prescribed medications, which is not going to necessarily be healthy for you, as well as some of us resort to alcohol or overeating. And a lot of times if we have a really stressful schedule and we're trying to get to places quickly, we're going to do the most convenient thing. So you're going to pop into McDonald's, or you're going to pop into to get that Tylenol real quick, or sleeping too little or too much. If you're extremely stressed out, that can lead to issues with sleep. So you can have insomnia, or you have trouble falling asleep or staying asleep, and that's going to have an effect on your health as well too. So, and then a lot of us are working 2 jobs, or I even have patients working 3 jobs, and so again, that's going to give you a lot of stress, and it's going to start to take a toll on your health too. And then there are some people who like to just avoid it altogether, and they just internalize everything. And so internalizing everything is probably the worst thing you could possibly do for your health, in a sense that you're not necessarily going to feel every time you internalize something, but it does start to build, and that's when you'll start to see symptoms show up on a physical level. So what are the signals that you can see? These are just some examples, but there's headaches, low back pain, neck pain, the stiffness that I had talked about up here. There's digestive issues that can occur, like ulcers or acid reflux. And there's also things that you might not even think about, like asthma or allergies, autoimmune issues, all come from stress. And so what can cause these symptoms, though, that a lot of us kind of overlook is about the function of your body, or how well it's functioning, and that's where the nervous system comes into play, because that's what's regulating your body and actually allowing you to cope with all the stresses that are going on in your life. And so I'll kind of grab the spine here. Where the spine comes into play in chiropractic is I'm not always just looking at the spine, but it's actually more about the nervous system because like I just said, it's going to regulate the function of your body. So you have your brain sitting up here, which is connected to your spinal cord. And then from your spinal cord, you have all of the nerves coming out to every single cell, tissue, and organ in your body. And so what happens is, like I talked about a couple of slides earlier, with all of the things that we're eating, the traumas that we've experienced, the bumps and bruises, and then also the emotional stress, that can push or pull your spine out of alignment. And then what happens is that communication between your brain and the rest of your body is going to be interrupted. It's not necessarily cut off in a sense that if this is the nerve going to your heart, it's not going to stop your heart. But what it's going to do is it's going to interfere with the signal getting there. And so over time that builds and builds and builds, and that's where the symptoms start to show up. Your body's trying to say, hey, there's something going on here. And then that's where you want to try to pay attention to those so that you can fix them. So if you have a compromised nervous system, if you have a subluxation in your spine, this is where, like I said, you're going to have dysfunction in your body, or your body is not going to be functioning to its full potential, and that can lead to the symptoms. And one of the ways that I look at that is I don't even have to, I can just look at you from the outside and I can look at your posture because it's literally the window to your spine in a sense that it's going to tell me wherever you have any postural imbalances, it's going to tell me exactly what area of the spine and the nervous system that could be potentially compromised. So, and since your posture is also going to tell me what organs and tissues could be affected as well. So you guys have a sheet there that we kind of passed out with some written symptoms, signs, and symptoms on there. And I just want you to take like a few seconds to kind of look and see if you have any of that going on. And if there's any, and there's also a flip side to it as well, because it's not just adults who, everyone has a spine. And so a lot of times kids are developing and they're falling and having bumps and bruises as well too. And so since they are developing, a lot of times it's really important because there are things that can go on with kids that could be potentially due to a compromise of their nervous system as well too. So just take a second to fill that out. Great tool for me to kind of look and see if there's any potential issues that could be going on that could compromise your nervous system. And some of the things that I look for is I can look to see if you have a lack of curve in your neck, if you have an uneven pelvis, if you have what we call forward posture or anterior head bridge, and then also the slouch posture or the rolled shoulders. Things like that are all going to tell me where and if to what degree there's a compromise with your nervous system. And then that's going to in turn clue you in if you have any symptoms going on. It's going to let me know exactly what level of the spine could be compromised as well too, because they all go to certain organs and certain tissues, and so it lets me know that. This is just an example here. So one of the things that I just mentioned was that forward posture. This is what I see a lot actually come into play because we're at desks a lot, so we're looking at the computer, we're watching TV, we're driving, we're texting. All of this forward posture is going to start to push your head forward, and your head does weigh approximately 8 to 10 pounds. So every 10 millimeters that's forward is about 8 to 10 pounds of pressure. And so a lot of times, you know, I have 3 to 5 inches in there, and that's actually up to around 100 pounds of pressure of stress that's going to be put on your neck. And so what that does is if you have stress on your neck, let me show you what we're finding here. You should naturally have a curve, and if your head's forward, you can see what that's going to do to the discs and then also to the nerves through here. And that can actually lead to a lot of things like headaches, asthma, allergies, neck pain, lots of other things as well too. It shows up differently in everybody, and so this is why coming to get checked is you can be a little bit more specific as far as what's going on with each individual too. And so some of the things that you can do is you want to exercise, which is going to alleviate your stress. You also want to eat a well-balanced diet, drink plenty of water and stay hydrated, and then improving your posture and being proactive about maintaining a healthy nervous system is kind of the key, I think, into making sure that you are maintaining your stress levels as well too. How long? Okay, so this is a little bit of a pyramid here, kind of categorizing like vital needs for health and wellness. And so nourishment. How long do you think you can go without eating? Yeah, that's
10 minutes.
10 minutes.
I hear you.
To survive.
Or some snacks. Good old almonds.
Do you have an idea? You can go about 4 weeks without food and survive.
Wow.
So,
Yeah.
so food is important, but not that important. Okay. What about water? Hydration. How long do you think you can go without water?
3 days.
Yeah, it's about 4 to 7. So we say like 1 week max. What about oxygen? You can go about 4 to 5 minutes without oxygen before. What about nerve flow? Seconds. So if you don't have, if your nervous system is not functioning properly and you lose that nerve flow, if you were to sever your spinal cord, you have seconds, literally. So this is why, I point this out because your nervous system is so vital. It is the absolutely hands down the most important organ system that you have in your body. You can't function or live without it. And so this is why maintaining a healthy nervous system and a balanced exercise, balanced nutrition, and then a healthy nervous system, that's going to allow you to basically function and keep an optimal level of function throughout your life. So that's why I just want to point that out. And so you don't want to ignore the warning signs that your body could potentially be giving you. And so this is why I asked the question, how well is your nervous system functioning? So, like Nicole had mentioned before, we kind of wanted to talk with you individually, and then we have given you some questionnaires so we can kind of go through and look at your posture and see if there's any potential issues, underlying issues going on there. questions? Short and sweet. Does it make sense, all the information?
So if no one has any questions, then what we do when we come out in the community, what we do when we're in the center here, and anywhere in the